8 o'clock this
As they wait for news of their daughter's operation,
3 o'clock
Keith
now.
Weiss begins to consider her surgical future.
Probably the biggest fear of the entire operation to me is what happens with the rods. If the rods would happen to back out in the future, what do you do?
More surgeries may be in Rebecca's future.
Brought to you in part by the Purell brand. When there's no soap.
Four-year-old Rebecca Weiss is in post-op after a successful 4-hour rodding surgery on her legs.
Hey, Becca. Hey, Becca.
Here, Daddy.
Can you see Dad?
Daddy's here.
Can you see Dad?
She asked for Rochelle too right away.
You want Shell to come see you in a little bit? Do you? How about Sarah? Ting? How you feel? Yeah, your legs hurt? Yeah, they fixed them. Do they feel like they're fixed? Probably not.
You got zippers in there? Is that what you feel? Huh? Okay.
As a treatment, rodding is a state-of-the-art procedure for children with brittle bones, but it isn't perfect. The lifespan of the rod is limited. As a child, Sean Stevenson went through multiple rodding surgeries and has grim memories of having to go through what doctors have labeled a change-out of the rods.
It was so excruciating. I remember as the bone, I could actually feel the rod slipping out of the bone. Dragging across, I don't know, maybe the bone marrow, the nerves, whatever. It felt not like anything I'd ever felt before. And I know that words can't do it justice, but it really felt like a vacuum was turning my leg inside out. And I remember my heart was beating so fast, and I was sweating so profusely, and my mom about passed out. She turned so many different colors, and I was just screaming out in so much pain.
Even though he looks like any other healthy 9-year-old, Jojo Sturm is anything but. His outward appearance masks a framework of bones that are extremely fragile.
Pain is something Jojo lives with on a regular basis. With brittle bone disease, the cold and darkness bring on a lot of pain in the bones of a child, which exacerbates the condition.
It's been a while since we had this kind of snow, huh? Oh, good. This is a great shot. Open up.
Carone has sought help for Jojo's OI since he was an infant, looking for answers over the net and keeping a journal about what she's discovered. Now, after many months of her son being on the drug Fosamax, the results of his latest tests are disappointing.
We tried it for, I don't know, probably 6 months. And again, no significant reduction in fractures. But it led to a very exciting thing. After we posted the information on the internet, we sort of had a following of people who would check in on the website and see what we'd tried and how it was working. And out of the blue one day, I got an email message from Dr. Glorio in Montreal.
Caroline and I, we got in touch by email. It's interesting because as I was getting really tuned in the email and web browsing, etc., I use Osteogenesis Imperfecta as a search tool. And I ended up on her site. And the site was a picture of Jojo telling his story and saying, I need help. So I wrote back and I say, maybe I have something for you.
Dr. Glorio's search for an effective treatment for osteogenesis imperfecta revolved around a drug called pamidronate. At the Shriners Hospital in Montreal, the patients were receiving an infusion of pamidronate every 4 months in the hope that the drug will stimulate bone growth and strength. For Carone, the burning question is, will pamidronate stop the destruction of bone in Jojo's body, give him some relief from the pain of the disease, and allay her worst fears for her son?
We want to get him in as good shape as we possibly can before puberty, because that would determine whether or not he's going to be in a wheelchair, for the rest of his life. And you do tend to just live day to day too. You just don't want him in that pain. I mean, that's on the forefront of your mind.
With Dr. Glorio's help, Jojo is placed on a pamidronate treatment and begins his infusions in a local hospital in Alaska. Even the simple act of placing a tourniquet on his arm brings tears.
Let's do it. Now, what I want you to do is make a little bit of a fist run. Not a real tight fist.
Jojo endures the pain as he has so many times before, and this time the story takes on a turn for the better.
Jojo has now had 3 pamidronate infusions, and we are thrilled with the results. The improvement has been nothing short of dramatic. The chronic bone pain is gone, stamina and endurance have improved, and he's grown over 4 inches. He now walks independently much of the time. And while he still suffers an occasional fracture, they are consistently the result of significant trauma. We're amazed at the number of times he has not broken when he's tripped, fallen, or been involved in some sort of mishap. This all seems too good to be true. For us, it's been sort of a miracle drug. We know it's not the ultimate cure, but I mean, it's certainly better than anything we could have hoped for, really.
I can easily do pretty much all the things anyone else can do. It's just I really have to be careful.
Let go of this for a minute and just walk. I'm going to just take this and you just walk. Now you walk. Now I want you to think about trying to walk without your side-to-side tilting. Do your best.
4 times a week, Jojo undergoes therapy in order to increase strength and mobility.
See, you're starting to collapse a bit.
8, 2, 3, 4, 5. I did that count as 2 sets because I held it. I'm happy now. I'm fine with this.
In a 5-year study in Montreal, they showed that a significant number of pamidronate patients have seen the pain decrease and their fracture rates drop. By using bone density tests, they have proven the drug has often reduced the rate of bone destruction. While testing is ongoing, the pamidronate study shows promise for treating OI patients with the drug.
The will of these children and the families to go through the incredible fractures and rottings and spine straightenings and all the things that these poor children were exposed to and their families were exposed to. It's devastating to most marriages. They just couldn't, it's horrible. Fortunately now, with this new therapy, that history is being changed. We're not going to have to see that. Now it's a miracle.
For everyone touched by osteogenesis imperfecta, the disease is still very much a mystery, though the clues are starting to mount.
Well, how about we do this with...
We will figure this out. I feel confident of that. Maybe I won't be the one to do it. I hope that what we've done and the things that we've done may provide a platform maybe for somebody else to fall on some lucky observation that will clearly show that it does work. But I feel confident we'll do it. It will happen in my lifetime, although I may not be the one that does it. That I feel very confident of.
On Discovery Health Channel, real life, medicine, miracles.